Why do stem cell injections work for some people, but not for others? That's what I'm answering in this video. My name is Dr. Garcia. I'm a leading expert in stem cell recovery. I'm here to help answer that question in the event that you are considering stem cell injections or you just had them and you're wondering, why am I not responding like others? So there's three real components to help you understand why some people accelerate their healing and why some people have minimal to no improvement. There's three things besides just saying it depends on everyone. I'm gonna give you three ways to approach, is this gonna work for me? So the first one is what happened in the past. So this is where we would look at your history, your past medical history. Were you is it your knee that you're having injections on? And did you have a motor vehicle accident? Or did you fall off of a ladder? Or if it's your low back, did you have multiple surgeries? Did you have a broken piece of bone? Did you have herniated disc? What's the level of trauma that happened to your back? How extensive has that been? Now that is the past, and a lot of times people who have significant or extensive past medical histories, or they have bone-on-bone issues that maybe stem cells will be able to help, but it might only be to a certain amount. So those with an extensive past medical history, multiple surgeries, those individuals might have different outcomes than maybe you've had 8 to 10 years of chronic pain, but the tissue itself is looking good and it just needs a little bit of a boost. If you've had chronic pain where you've also dealt with maybe the psychological challenge of pain, that's a different factor as well. But ultimately, what is the quality of the tissue that before you came into stem cells, how good was that tissue? Because those stem cells can only help that tissue so much. So those who have dealt with chronic issues and their bone tissue is very poor, maybe you have a rotator cuff tear and it's a grade 3 and it's completely torn and it's completely separated. The amount of work that would take for stem cells to repair that would be significant versus somebody who has a grade 1 or 2 tear, meaning it's a mild or a moderate strain, but there's still tissue holding on. The stem cells can come in and create a little bit more resilience there. So it depends on how extensive your past has been. If it's been quite extensive, you will feel improvement, but there might be a small ceiling effect to that versus somebody who has good looking tissue, they've just had trauma recently and they haven't been able to overcome that. Stem cells might be able to help pretty well. So the past, you really can't do anything about. So if you had significant, maybe you're having a slower process and it's taking longer to get those results, that's pretty normal. The second part is the present. That is what you're currently doing now to maximize your outcomes. So you might be somebody who had an extensive past medical history or a moderate past medical history, and you're a good candidate, so you had the injections. Well, the past you can't control, it just meant that you were a good candidate. Now that you've had this, the present is, what are you doing right now to maximize your outcome? And after helping clients all over the world who've had stem cell injections, I can tell you the majority of people, 80% of people, haven't thought about, well, what do I need to do in my recovery process to get better? Because all the thought process, all the energy went into what should I consider before getting these injections, and you made that decision. But now you're stuck and you're thinking, whoa, I didn't realize it's quite the extensive process to recover properly, up to 6 months. And it is very, very calculated that every single progression is built on the previous. So if you come in without an idea of how to do this, maybe you hire somebody who's cheap, local, or convenient, you're gonna get those results. So that can affect why it's working for you and not others. So if you found yourself with a significant past medical history, your tissue was very poor, and then on the recovery side, you decided to skimp and save on money, and you hired somebody who maybe can help in the past, they've helped you with your neck or your back, they're not a specialist, they've never managed stem cell recovery, and now here you are, you were a decent candidate for stem cell injections and you're not doing it appropriately for your current rehab process, your recovery timeline. That's the result you're gonna get. So one of those pieces is the past, which you can't control. but the present is what you can control. So if you're doing that poorly, or if you have no idea what that recovery process is, you want to find an expert who knows what to do specifically with stem cells. That is the thing that you can control. And the people who have the greatest control of the recovery have the greatest expectation of proper recovery and outcomes. So If you had extensive or moderate past medical history, and then you do the recovery, the present, control that as much as you can, you're going to get the maximum outcome. Now, if you've had a significant past medical history with bone on bone, and you don't do the recovery process properly, that's probably not going to be the ideal scenario for you. And those are two different people, and you can find yourselves in that. The third part is, the first part was the past, you can't control. The second part is the present, which you can control. And the third part is your genetics, which you can't control. This is about how your body responds to those cells, how it responds to the healing process, how much it flares up. Sometimes your body will react and it fight back, and they don't accept those cells so much. And that's just who you are. And unfortunately, we can't know that until you have the injections. So there's a portion of this that is truly you and your cells and what makes you so special and so unique that we cannot control. The past, we cannot control, and genetics, who you are, we can't control, but the one thing we can is how well you recover. So if you are stuck and you're saying, well, I had this extensive medical history, I feel like I've had a lot of trauma and that's why I got these injections, and you feel like you haven't responded to things in the past and your genetics aren't working as great, the best thing you can do to maximize your injections is control your current environment now to recover properly. And this is a 2 to 4 week timeline within each progression to maximize your recovery. From 0 to 6 weeks, you're doing body weight and movement. From 6 weeks to 12 weeks, you start doing a little bit more resistance. At 12 weeks, you get back in the gym and slightly increasing weights. At 4 weeks, you're back in the gym and doing a little bit more. At the 5-week mark, you're doing your functional activities. At the 6-month mark is when you feel really, really good. So as you go through this process, it's very structured. And if you take this haphazard approach and based on how you feel, those are the results you can get. So I can tell you, after helping people all over the world, if you've had you worry about the past, you can't control that, and you worry about your genetics, you can't control that, but you can't control now. Most people aren't doing that. So if you feel you're stuck and you want to control and maximize everything you can, control your current environment, reach out to me and my team as the Stem Cell Recovery Experts to ensure that you're doing the right things with the present, the things you can right now to maximize that outcome. If you continue at the rate that you are and you're not making a steady progression, you're not working with somebody who knows what they're doing, you're taking that guessing game, maybe at the 4-month mark, or maybe you've had surgeries before and you think, oh, this is going to be the same. This is not the same. This is not the same as a surgery. It is not the same as a cortisone injection. It's not the same as PRP. It is unique in itself. So if you're looking for that direction, you want those outcomes to be maximized and you want to be able to control these variables, we're excited to help you along that recovery process. Take it easy, take it slow, and we're excited to be able to help you along that journey. Hi, if you found this video helpful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for my weekly tips on recovering safely to create long-lasting results after stem cell therapy. Thanks, and I'll see you soon.